Hi there. I'm Meena, and I've had systemic lupus for a few years now, um, even though I was diagnosed just a year and a half ago. And since I'll be talking about it in this video, I'll tell you my lupus symptoms. They're primarily arthritis, skin rashes, fatigue, and cognitive issues. So my lupus is currently inactive, but I'm still symptomatic, and I have to be really careful not to overdo it, or I'll have a flare up. And so in this video, I'm going to talk about my lupus and my pregnancy as they're related to one another. I became pregnant in August of 2017, so about a year ago, and I delivered a healthy baby boy this past May. And during that time, I learned a great deal about pregnancy and lupus, of course. So I'm going to cover some educational material, need to know stuff, and then break down my pregnancy by trimester. So before I get started, I do just kind of want to put a medical disclaimer out there. I'm not a medical professional. I'm not giving medical advice. I'm just sharing the personal experience in the hopes that it helps others going through this. And so, be sure to always consult with your doctor before making any medical decisions. So lupus and pregnancy did not always go together. In fact, for many years, doctors would kind of strictly warn lupus patients not to get pregnant. And some doctors still feel that way, but the good news is that most doctors have come around, they've changed their minds and realized that a healthy pregnancy is possible for a lot of women. And the main reason that a lupus pregnancy has become more of a reality in recent years is thanks to advancements in medication. So decades ago, before there were quality treatments for lupus, the illness would just kind of rage uncontrolled for a lot of people. And that's, it's really bad for your body. The estimated life expectancy for someone with lupus was only actually 5 years after diagnosis. But in the 1950s, they started having new medications like Plaquenil as an anti-malarial medication that started being used for lupus during that time. So the statistics have changed significantly since their effective medications have become available. And today, most people with lupus can expect to live a normal lifespan as long as they take their medicines as instructed and treat the disease aggressively. So if you have lupus and you want to become pregnant, there are a few boxes you need to check off first. One is that your lupus should be in remission for 6 months before you start trying to conceive. And this is especially important if you have lupus nephritis because it can impact the success rate of a pregnancy much more significantly. My pregnancy was actually unplanned and my lupus wasn't fully controlled for 6 months beforehand. And thankfully it worked out for me. I definitely don't recommend doing that. But if you find yourself in that situation, just try to get your lupus under control as quickly as you can. And so the next thing on your list to check off is to find a high-risk OB and or a maternal fetal medicine doctor. You'll also need a top-notch rheumatologist that has experience in pregnancy with lupus if you're already seeing one. It's best to decide on your treatment plan talking to all three doctors, having them communicate with you and with each other. And so you want to decide on that treatment plan, and then you want to start it before you start trying to conceive so that you can make sure that it's working for you. You don't want there to be any big bumps in the road, aside from your baby bump, of course. And so I actually didn't find out I was pregnant until I was 7 weeks along, and I had to scramble to accomplish these things. And it was really stressful not to be prepared. You don't want to have sources of extra stress in the first trimester. It took me a few weeks to find a good high-risk OB who then referred me to a maternal fetal medicine doctor, who I finally saw when I was about 12 weeks along, and we were able to hash out my treatment plan. And then I had a bad experience with my rheumatologist at the time, so I had to find a new one. But it took a few months for the referral to go through, so I didn't actually find a quality rheumatologist until the end of my second trimester. It was a whirlwind. But the good news is my new rheumatologist was excellent and experienced. And so part of the reason why you need this great team of doctors is because of the high-risk nature of a lupus pregnancy. There are several things that you as a woman with lupus are going to have a higher than average risk for during pregnancy, like intrauterine youth, excuse me, intrauterine growth restriction, which means the baby isn't growing as big or as quickly as they should, pregnancy-induced hypertension, preeclampsia, preterm birth, not to scare you or anything, but getting thorough and regular prenatal care is absolutely critical for a lupus pregnancy because it can help prevent or at least manage these conditions and keep them under control as much as possible. And you'll also need to have some extra medical tests because of lupus, in addition to all the normal tests you would get during a pregnancy, such as tests for SSA and SSB antibodies, because these are linked to an increased risk of neonatal lupus and fetal heart block in the baby. You also may want to be tested for antiphospholipid antibodies, since people with lupus are more likely to have the condition, even though you probably already know if you have it, but you definitely want to rule it out before entering a pregnancy. Like I said, with a lupus pregnancy, you just want to have as much information as possible. So I was running a bit behind in my first trimester, checking all those boxes, like I mentioned, but I did eventually get all the tests and the treatments that I needed. And I took Plaquenil, which is an anti-malarial medication, throughout my first trimester. And that's highly recommended because it can significantly increase the chance of a good pregnancy. If you can tolerate it, it's really effective. And it's a pregnancy category C, which means that the risk has not been ruled out. They can't say it's 100% safe, but with lupus, the risk is relative. And Plaquenil is definitely one of the safer drugs for treating lupus during pregnancy. Someone whose lupus is under control thanks to taking Plaquenil is going to have a much better chance of a healthy pregnancy than someone whose lupus is not really under control and they haven't been taking Plaquenil. Another medication that I was taking when I became pregnant was Imurin, and that's an immunosuppressant medication. And this is actually part of the reason why I didn't realize I was pregnant at first, because I had increased my dosage right around the time I was around 4 weeks. So one of the main side effects of Imurin is nausea. I attributed all my morning sickness to the Imurin and didn't think much of it at first. And then when I did find out I was pregnant, I told my rheumatologist, and he said to stop taking Imurin. It kind of scared him, I think, because it's a pregnancy category D, which means there is evidence of risk when it's used during pregnancy. And so I couldn't continue taking Imurin until I got permission from the maternal fetal medicine specialist 5 weeks later. And by the time I saw that doctor, my lupus was starting to take a turn for the worse because I had been off my Imurin for 5 weeks. It was really negatively impacting my health. I was starting to become really physically limited, just feeling sick. And so the maternal fetal medicine doctor told me that in my case, taking Imurin was less risky than having a lupus flare during pregnancy, because flares can be dangerous for mom and for baby. And this game of risk versus benefits is something you're going to have to play throughout pregnancy with lupus. And since your risks will be so different from the average person, you may experience some real pushback on your decisions. For me, my pharmacist felt that I shouldn't have taken Imurin when I was pregnant, and I had to get my maternal fetal medicine doctor involved in order to get my prescription. And there were some people in my life that were really kind of appalled that I would take so many medications while I was carrying a child that was exposed to some of them. So you may find it better to play things close to the vest if your friends or family or coworkers might not be on board with your decision, especially if they don't understand what your life with a chronic illness is like and what you're going through. So aside from deciding on my medications during my first trimester, I also talked to my doctors about how we can differentiate between symptoms that come from lupus and symptoms that come from pregnancy. Because there's actually a long list of symptoms that can kind of overlap, and you're not really sure which belongs to which. This includes swelling, fatigue, joint pain, shortness of breath, redness in your face. Is it a pregnancy blush or is it a lupus rash? One symptom that's particularly concerning is protein in your urine, because this can either be from preeclampsia or lupus nephritis, which are both dangerous conditions. So my OB was concerned about this, and what he did was he collected a 24-hour urine sample early in my first trimester that kind of served as a baseline. So later on, if there was more protein in my urine, we could say, okay, if my lupus is active, then this is more likely to be lupus nephritis. But if my lupus isn't active, there's no seeming kidney involvement, then this is more likely to be preeclampsia. So you need your doctor to be able to kind of mitigate these kinds of risks. And overlapping symptoms. And as far as my pregnancy symptoms, I was so nauseous during the first trimester. I actually lost 20 pounds. But I had 20 pounds that I could lose safely, so I didn't have to take any nausea medications, although those can be pretty effective from what I've been told. And I also experienced the fatigue that's really notorious for accompanying the first trimester. And fatigue is a huge part of my lupus, so I'm never really surprised when I get tired, and I didn't think a whole lot about it, but then it did become more severe than I'm used to the point where it just kind of seemed impossible to stay awake. I'd wake up and say, what time is it? What day is it? I don't even know where I am. But most of those things, especially the nausea and the fatigue, faded as I started my second trimester, thank goodness. And I was a few weeks into my second trimester before I stabilized because I had to stop the MRN and restart it. It takes like around 6 to 8 weeks for it to kind of fully build up back in your system. But overall, for me, the second trimester of pregnancy was definitely like the sweet spot of the whole thing. You know, the honeymoon phase, like everyone says. I did develop anemia, which isn't that unusual. People with lupus have a higher risk of it anyway. I think it affects around 50% of people with lupus for various reasons. Inflammation can be one reason, and you're more likely to get anemia when you're pregnant. So, at least the good news is that it was fixed pretty easily with my supplement. And then towards the end of the second trimester, I had to use my first round of prednisone because I had like a symptom flare up. So, you know, all my symptoms like my arthritis and my rashes and my joint kind of went haywire, and I felt horrible, but my lupus wasn't actually active or forming. So I just used the prednisone to kind of treat my symptoms so that I could, you know, function, cook and clean and take care of myself, which is essential when you're pregnant. And some autoimmune diseases, like rheumatoid arthritis, they have a tendency to go into remission during pregnancy. But this isn't necessarily the case with lupus. I think the jury is kind of still out. There's some women who have a lessening of symptoms, and some women who feel like they're sick for the whole pregnancy. So that if anyone's ever told you, you know, my autoimmune disease went to remission, that's not necessarily universal. So I definitely wouldn't count on that being the case. And then in my third trimester, I had more of these symptomatic flares, and I used a couple more rounds of prednisone. You can take chronic prednisone if you need to at certain levels during the pregnancy. Like I said, it's just risk versus benefits. But thankfully, my lupus was never active in the third trimester. And after 32 weeks, I had to see my OB. Well, it was actually a team of OBs that I saw. I had to see them every week at their high-risk clinic. And then at 32 weeks, we also started doing non-stress tests, which is when they strap the fetal monitor on your belly and they record the baby's heartbeat. And so they're looking for times that the baby moves and their heart rate shows an elevation, which means that everything's normal, the baby's healthy and strong. And then starting at 35 weeks, I had to have 2 non-stress tests plus the appointment at the high-risk clinic every week. And so that was very time-consuming. But of course, I'm glad that we monitored my baby really closely. I didn't have to worry or stress about whether or not things were going the way they should. And so that's something you really need to do with a high-risk pregnancy is everything the doctor recommends, even when it seems like a pain in the butt. Another thing that was hard was that I really had to limit my pain medication during the third trimester, which was difficult to do because I have a lot of lupus-related pain, especially as I became more limited as I got bigger. I wasn't able to do the exercises and the stretches that can sometimes help with my pain. So I had to limit my pain meds because I take an opioid medication, and we needed to make sure that the baby didn't go through withdrawal after birth. from being exposed in utero. And I take a very low dose of pain meds to start with. And so they told me, just take it 3 times a week or less, and you should be fine. And it was. It worked out, and I really didn't have any issues. I did have a lot of difficulty coping with my pain, but I was able to, for the most part, be okay. I wasn't dependent on it, and it was my baby, and that was the end goal. And then, of course, you can take Tylenol, but as a lot of you probably know, that's not very effective for severe pain, and you still can't take that much of it. I know for a lot of people, me included, it gives me rebound headaches, so that might not be a great option. And then I also had issues with fatigue in the third trimester because so much energy was going into making a baby. I think especially making the baby's brain develop more towards the end of what that energy is going to. And then I wasn't sleeping very well, which was definitely contributing to the fatigue. Between heartburn and restless legs, baby kicks, that all kind of leads to insomnia. And then lack of sleep can make my lupus symptoms and pain worse, which means I sleep less. And so it just kind of becomes a cycle. And I think I was only sleeping 3 or 4 hours a night for the last 2 or 3 weeks. So that's tough. And another thing you'll really want to contemplate with lupus in pregnancy is the possibility of postpartum flares. It's common for rather severe flare-ups to occur around 6 to 8 weeks postpartum. And I had one right at 6 weeks. When you add that to around the clock caring for a newborn baby, that's very intense and very hard on your body, regardless of whether or not you're breastfeeding. And so I definitely encourage any woman with lupus to just really think hard about pregnancy and parenthood from all these angles. Make sure it's what you absolutely want, because it's so much work and it's so hard. But of course, if it's what you want, then it's definitely worth it. And having lupus, it can really change the dynamics of pregnancy. Lots of women like myself have done it successfully. Some people even decide to do it twice or more, but it means you have to juggle caring for yourself, caring for your baby, and caring for your body while trying to manage a chronic illness. And so in this video, I kind of went over some of the reasons why pregnancy with lupus can be so high risk and what you can do to prepare yourself appropriately. And I talked about how, what's true for other pregnant women might not be true for you. So filter your sources of information. And of course, I talked about my pregnancy and some of the harder parts and what I recommend. And I've also written in more detail about my pregnancy on my blog. So if you're really, curious for more information, you can find that link to my website and my profile. So you can reach out to me there. You can find me on social media. Those links are also on my profile. And lastly, I want to recommend this Facebook group. It's called Mamas Facing Forward. It's a private group. It's for moms or people who hope to be moms, but also have a chronic illness. And so it's a supportive and encouraging group. It's really unique, and then it's such a positive environment. And I've been really grateful to be part of it. I joined it about halfway through my pregnancy, and it's just been so great for resources and empathy and people who really understand what you're going through uniquely from the perspective of other mothers and families. So thanks so much for taking the time to watch this video. I hope you learned something and you enjoyed it, and I'll be talking to you soon. Bye.